Hello, everyone. I am Margaret Ekaito Olusonya of IMA AG Healthcare Services, and I'm here to talk about proper communication in healthcare services. Now, we've heard about catheterization, we've heard about the use of proper healthcare application during COVID-19 and other dementia as well. Today, talking about proper communication, that is very vital in healthcare services. Now, first, what is communication? As we all know, in general terms, communication is an interaction between a person and an individual, or two people or more. In this case, between a patient and the doctor or the healthcare personnel. Now, we have various forms of communication. We have the verbal communication, we have the non-verbal communication, and we have the visual communication. Now, for the verbal communication, it involves spoken words to people who can actually hear you. They can actually hear and understand what you're talking about. The non-verbal communication involves postures, facial expressions, okay, for those who have hearing impairment. And for visual communication, it involves the use of pictures, diagrams, and the likes of it to communicate to people who cannot hear you or who cannot even understand what you're saying. Okay, this gives them a broad visual of what you're talking about. Now, respectful communication is important in healthcare because if this is not given properly, whoever it is you're communicating with, that is your patient, can get the wrong impression of what you're trying to tell them or the healthcare information you're giving to them. And then they tend not to use their medications properly or take the healthcare serious. Now, if you don't communicate what you need to do with your patients, they would have the belief that something is off with them. Now, when I say that, where I'm going to is this. A patient has the right to be involved in every discussion and decision involving their healthcare services. So when giving them healthcare services, make them involved, get them involved in whatever it is you are talking about. Do not keep them aside and say, okay, we'll decide on their behalf. They have the right to be a part of their healthcare services. Now, moving further, I talked about respectful communication. When this is done, it creates an interaction or a connection between a patient and even the healthcare personnel. Because once you don't have good rapport with them, you tend not to be able to give them the best they need, and the fear of death is already in them. So when you don't communicate properly with your patients, they tend to go off track and they might not even get the proper health care that is needed. And once proper communication has gone in place and proper health care is involved, they tend to respond to treatment effectively and properly. Okay, I'm going to round up with this. In the healthcare system, as healthcare workers, our patients' understanding of whatever information or healthcare practices is important. When you don't communicate with them properly, you put them off track and even endanger their lives, both with the medications they are to take, because if it's not properly related with them, they tend to take the wrong medication, and that can cause adverse effects to their health. Okay, respectful communication with our patients is very important in every aspect, especially when we talk about giving them their medications. When you don't relate properly with them on what they're to take, why they're to take it, and how they're to go about taking it, they tend to use it wrongly, and it can cause adverse effects to their health. Now, IMA AG Healthcare Services is an institution that trains professionals in healthcare services, doctors, nurses, healthcare workers, healthcare assistants, and the likes of it. So I would encourage us to do well to be a part of this great institution. Thank you.